Well, welcome to Rebecca Foster, and to all of you that are on the call tonight. Rebecca's going to be talking to us about healthcare decision making with our youngsters with a disability and a chronic health illness, and she's been part of a project with the URLEND folks in Utah and Montana, right?
Yeah, there's actually 5 states in that region, but yeah.
Sure. And so she's going to let us know a little bit of information about herself and some of the projects she's doing at Minot State and about this project as well. So Rebecca, thanks for joining us, and take it away.
Okay, thank you for having me. So by trade, I'm an occupational therapist, and I have a cat that's trying to get my apologies.
No, no worries.
So I currently work at Minot State University with the North Dakota Center for Persons with Disabilities, and I work in the early intervention program as well as help out on a couple other grants. So we were talking earlier about an ECHO project. The one that we're working on is related to infants born with the neonatal abstinence syndrome, so born with substances in their systems. And then also I'm teaching for the first time this semester with the special education department. So kind of doing a variety of things, but yeah, really enjoying the work. So tonight's presentation comes out of a project that I did when I was a URLEND trainee, and that was during the 2020 to 2021 academic year. And each of the trainees that participates in this works as part of a group project. And so the project that I got to be involved in came from one of the parent advocates who works with URLEND, Jen Vanna, and she's the current Montana Family to Family Health Information Center coordinator. And so this project was kind of her idea, and so I'm really excited to share with you tonight, and hopefully you'll come away with some great ideas and strategies that you can use. So I'm just going to share the screen.
And we're familiar with Jen.
Oh, are you? Awesome.
Oh, for sure. Yep.
She was so great.
Yeah.
Really enjoyed her. So, okay, so I already told Doneen if there's questions, feel free to interrupt or put them in the chat, and she'll interrupt me because I can't see them right now. So, oops, I'm gonna go back to the beginning here. Oops, I'm in the wrong direction, sorry. Okay, it doesn't want to. There we go. Okay, not sure why it started where it did. So, so as I mentioned, Jen Vanna was the one who was our family consultant, and then our faculty member was Molly Kimmel from the University of Manitoba, and she's a professor for occupational therapy there, I believe, as well as being on staff with their USED. And then I was part of a group of 5 trainees, and we had another occupational therapist, a speech language pathology student, and then 2 genetic counseling students. And the students were all in their last semester of, or last 2 semesters, I guess, of schooling for their master's program. So, so Jen Vanna really felt that there was a need to come up with a project that would support decision-making for children that had developmental delays or special healthcare needs, starting at a younger age. And there's quite a bit of literature out there and resources available for the transition age and above. The AUCD has a great tool on self-determination available on their website, and there's lots of great things out there, but there really wasn't a lot related to children, and starting working on that facilitated decision making at a younger age. And so Jen was kind of coming to Molly and the URLEND group saying, And this is something that would be a really great project to support families, to come up with ways to start that independence in healthcare at a younger age, so that when those kids reach that transition age and start working towards whether it's, transitioning out of school, transitioning into some young adult programming or some college programs, there's needs to be a way to support them kind of on the healthcare front as well. And, it was interesting, as part of my URLEND experience, I worked with a family, and they had a son who has cerebral palsy. He was 15 years of age at the time. And that mom shared with me that that's probably the one thing that keeps her up the most at night, is kind of worrying about what happens when you have to transition out of that world of pediatric health care providers, and how they're going to make that transition, and how she can prepare her son to gain some independence when it comes to healthcare decision making. So it was kind of a good reinforcer as we started working on this project, to hear that from that mom, that this is something that parents are concerned about, and if we can start working at this at a younger age, hopefully we can have children and families a little more prepared, as well as looking at the provider side of it. So one of the things that we noticed in our research was that providers didn't necessarily have a lot of background knowledge related to specific disabilities in their general medical education. And, time and knowledge were two of the biggest barriers as far as healthcare providers being more proactive in self-determination for their younger patients. And what ends up happening is that the healthcare personnel can focus more on, their concern about the cognitive skills of the child, or other things that don't really support looking at how they can increase the child's choice making or decision making when it comes to healthcare. So that was kind of what we learned through some of our research. And so on to the next slide. So our goal then was to create something that was tangible, a tool that parents could get their hands on that would be developmentally appropriate. It would be a resource to assist healthcare providers and their families in supporting children as healthcare decision makers starting from a younger age. And, as we did our research and kind of talked about what that would look like, we wanted a resource that could be used across disciplines. And then also looking at the development of children, not from a, age-related developmental milestones perspective, but really looking at the developmental stages relating to decision making. And so the goal then was to support self-determination and independence for children with a variety of healthcare needs. And, thinking about self-determination, Waymire, who's a gentleman who's done a lot of research on that topic, he refers to self-determination as a causal agent in one's own life. And so with that thought in mind, we recognize that self-determination isn't necessarily the same thing as independence. And so as parents and providers, we can support self-determination, recognizing that independence might be something that comes later in that process. Or, maybe they're never completely without support, but they can certainly have a bigger voice. So we did our research, and then part of what we needed to do as well was to get some input from parents and self-advocates, and we wanted to hear maybe from some young people as well. So we reached out in the states that we all were in, and were able to put together a work group that we did over Zoom. And we had 12 participants in the first work group. And I'm proud to say that several of those came from North Dakota. And so the parents and self-advocates in our area were very willing to take their time and invest in this project. And so I was really proud of that. So we had some parents, we had some adult self-advocates, and then we had some young people. Some of them were with their parent. And then we did have one healthcare provider. And that was probably the hardest part, was to get some healthcare providers that were able to take the time, and several showed interest, but just weren't able to make it work with their schedules. But we did have the opportunity after the fact to reach out some more via email and phone calls and get a little more input from them as well. So that was definitely beneficial. So then once we did our work group, we kind of did our research, talked about, how could we make this beneficial for kids from a variety of developmental stages. Then we started to create our resource. And once we had that kind of rough draft out, we were able to do a second work group where we sent out the resource ahead of time to the participants and let them have a few days to look at it. And then we met and got their feedback on what they felt was good about it, where they felt we could clarify things, add some more information. And so that was really helpful. One of the things that did kind of come out of that was a few of the parents and young people that were involved are at that transition age. And so they really felt that a lot of what was in the tool was beneficial for that transition age into young adulthood, even though that wasn't what we were targeting. And, we weren't able to really change the focus towards that because we were tasked with focusing on that younger age group. But we were all really excited to be able to recognize that some of the tools and resources that are in this definitely still are beneficial to young people that are transitioning into adulthood. So something to keep in the back of your mind if you find that this resource is something that you want to share with families. So getting into the product that we created, we called it Skills and Strategies for Healthcare Decision Making with Children. And we divided it into 4 developmental stages for decision making, and then developed kind of the resources within the book from there. So the 4 stages that we focused on were choice maker, question and answer, decision participant, and then decision maker. So the choice maker would be a child that's a beginning communicator. So they have some comprehension, they can listen, they're showing preferences, and they're beginning to communicate their preferences. So kind of thinking about, that younger child that's able to point or tell you with words when they want something, a child that's able to make choices between a couple different things. That's really kind of that beginning choice maker stage. And so that can be, as young as a toddler up to, depending on the child's communication abilities, later into childhood. And so we really didn't want it to be age specific. The second one is the question answer. So the question answer would be your child or your individual who has growing communication skills. They have the strengths of being able to ask and answer questions. They're curious, they observe things around them and make comments on that. And so they're really at that age where you can have a little more back and forth in conversation. And by conversation, I would add too that as we were developing this, we were keeping in mind that not every child is going to be communicating verbally. And so when we get into some of the strategies, that's where you'll see that, maybe a child's using a communication device, maybe they're using some other type of visual support. And so certainly we're keeping that in mind as we work on this. Then we have our decision participant. So the participant can tell others about their preferences. They're starting to take part in making decisions. And this is a stage where it's important for them to build confidence and independence. And so they can maybe set some small personal goals. And that could be something like being able to take responsibility for taking a medication at bedtime, or taking responsibility for taking care of their hearing aids, or you know, their AFOs, or something that they use for support. And then, you know, at this point too, since they're able to answer questions in some way, they can give their provider some feedback about what works, what doesn't work, and then start to take part in some decision making related to their health care. And at this point too, they can also help planning. So they can participate in maybe setting some personal goals related to healthcare, whether it might be exercise or attending an adaptive sports program or something like that. And then they can also be involved in the planning it takes to make that happen. And then we have our decision maker. So our decision maker has more advanced skills of communication. You would expect that this, you know, even if the child has a special healthcare need or a disability of some kind, they are going to be an older child or a teenager, because they are at the point where they can start to understand that there's consequences of their actions. They can understand what happens if they don't refill their prescription, things like that. And so they're really at that point where they're starting to become more independent, because they can communicate and understand how to be involved in their healthcare and what that looks like, maybe thinking about the future. And at this stage too, you know, if you think about a young person that is maybe facing a surgery or something like that, even at a decision participant level, you know, they might be able to be a part of that decision about what type of surgery they're going to pursue, as far as, you know, potential outcomes, or different things that could be involved in that. So this is a great stage as far as really looking at how you can start to plan for that more independent self-advocate as they transition out of childhood. So then, getting into a little more detail, we also created just a little brief checklist for families, or even, you know, an individual to look at, to be able to help them understand maybe what stage they're at when it comes to decision making. So just kind of a little checklist of things that they could go through to help them say, oh, yep, you know, they're starting to name body parts, they're showing preference for what toy or book they want, they know who they are when they look in the mirror, they're accurate in either with a head shake or a yes, or some other form of communication to let you know a yes or no. And so this is the checklist for choice maker, and then there's one for each of the stages to kind of help make that decision. And then the next thing that we did for the stages was, one of the things that came out of the work group that we really found helpful as far as feedback was that in talking to both self-advocates and parents and some of the young people, we kind of were hearing a trend of, there's three parts of the healthcare piece that can be challenging. One of them was preparing for the appointments, and that could look like different things at different stages. And then being at the appointment, and then the appointment follow-up. So what happens next? And so you'll see that at each stage, those are different things that the child and their family will focus on. So an example for preparing would be to do some role playing with the child, finding either a toy stethoscope or a real one, and then you know, practicing on the child, have the child practice on you or their teddy bear, talking about the sensory aspects of that, so that they're prepared that the stethoscope might feel cold and hard, And so that's just an example of some of the things that you could do to prepare. Another example would be practicing labeling body parts. We didn't show on this slide presentation, we didn't show everything in every box, but one of the things that I liked was the idea of, you know, you can involve other team members. So if your child's in preschool or elementary school, you could work with your speech therapist or your private speech therapist and have them create a social story that you could use to read to the child. And then, you know, use that for the week leading up to it, possibly even take it to the doctor's visit, just so that they know what to expect. And that's really the goal of the preparation, is so that the child knows what to expect will happen when they get there. And then the understanding of that is going to change as the developmental stage of the child changes. So then when you get there, whether it's a child with autism spectrum disorder or any other disability, and the child is anxious, having that bag of sensory items or some things that they can use to stay calm and help them with waiting. In my early intervention work, we had a little guy that he's extremely sensory seeking and also has some anxiety. And so going to speech therapy or occupational therapy is a real challenge for this little guy, because his brother goes as well. And if he has to wait in the waiting room at all, it's a big challenge for this mom. And so what we did was worked with the speech therapist to create a social story about just the idea of waiting. And his mom had a backpack of things that he took just when he went to those appointments. And then so we had pictures of that in his social story, and then just kind of repetitively giving him that message of I can wait, and just empowering him that this is something that he can handle with those supports that he has. And you know, the last feedback we had from that mom was that it was really helping, and that, you know, she wasn't dreading those appointments quite as much, because he was understanding that this was something that he could do. So that's just a little example of something that can be done at an appointment. And then for the follow-up, at that choice maker stage, you're going to be focusing on things that come from that visit. So if it's a new medication, you might use the first then format to say, you know, first your pill, then brush teeth. You could create visuals or visual schedules to go along with those expectations. And, you know, that's something that can be a beneficial tool almost at any one of, actually, I will say at any one of the stages. What it looks like might change by the time you're at that highest level of decision making. It might just be a checklist. But that's something that can really help with follow through on what you are doing that's new following that medical appointment. So that was the example of the choice maker one. So there's the same type of format for each of the 4 stages. And then we also created a resource section. And so we did it by stage and kind of color coded it. You'll notice that each of the stages is color coded in the resource manual. And then the resource section, if you can look to the right, that second to last column says stage, and you'll see that it's color coded in there. And so some of the resources are beneficial for all stages, some for 1 or 2. And so it's indicated in there what stage the resources would be most beneficial for. So you'll see things like the Melissa and Doug pretend play doctor sets or dentist sets, apps. There's a few apps in there that are listed. Got Transition, the website, so that's an excellent resource. And then for, you know, that decision participant or decision maker, even having things like an anatomy app, so that they can really kind of pinpoint what part of their body they're having pain, and so they can describe that more efficiently or show it to the healthcare provider. So lots of different resources in there that are, something physical and tangible to an app or a book. And there is a couple apps mentioned in there. I think one is Book Creator, and that's an example of an app that you could use on an iPad. And you can just put some information in there that the child's coming up with. So maybe it's a question, and it has a speech to text option. So you can have the child put the text in, or you can put the text in that the child wants you to put in there. And then when they're in the doctor's office, they can pull up that app and that little book that they created and press the speech to text button in order for them to have that empowerment to ask the doctor the question themselves. So lots of pretty cool ideas in there for ways that you can actually work towards that goal of independence. And then towards the back of the manual, we created just some worksheets. And a lot of these were based on feedback that we got in our work group. And they were things that, we dug around on the internet and saw, ideas of various things. And then we kind of tried to pull things that made the most sense to us based on the feedback that we got from the work group. And so if you download this tool as a PDF, you can actually fill these and print them out, or you could print them out and fill them in by hand. So they're very user-friendly. So the medical visit checklist just helps you, organize what you might want to bring, whether it's questions for the doctor or a social story for the child, what to bring to all appointments. So you'll see on that list a pain scale. And one of the families that I was working with during my URLEND experience, this young man that had cerebral palsy, who was 15, he went to the doctor, and he was telling me this story himself. And he said, I went to the doctor and the nurse showed me the pain scale and wanted me to show her, what level of pain I was in. And to me, it just looked like a bunch of emojis, and he really couldn't attach any meaning to it. And so it was pretty cool to hear that from him when we had already heard from individuals in our work group that, hey, a pain scale that kids or young people could practice using so that they're prepared for that question when they get into the doctor office, and they know what they want to point to or what they want to say when they get presented with that. So lots of great ideas that came out of those work groups for things that, we wouldn't have thought of on our own. So that was really great. Some of the other worksheets that we have, let's see, I think we showed this. So there's an appointment one. So this is one where you can write down your questions ahead of time, and then you could actually write down or have a parent or caregiver write down the doctor's answers to the question so that you can refer back to them later. And then for the person who is starting to be more independent, you can have that list of medications that you're on, what it's for, what color it is, how to take it, when to take it. So some things that can support not only independence when you're outside the doctor office, but then that's something that maybe the provider could help fill in for them when they're actually at the doctor's appointment. And then there's a list of things to do. So, maybe the doctor says, you need to go to, maybe a child is struggling with attending a therapy, and the doctor says, I really want you to go to speech therapy once a week. Having that written down, I don't know about your experiences, but I have always found in my career that sometimes having those things written down, kids don't fight them as much. If the doctor, this is what the doctor said, And so sometimes they'll respect that more than maybe a nagging parent. So kind of nice to have something like that as well. There's also, let's see what else it shows. Yeah, preparing for your doctor's appointment. So kind of talking through maybe with your child. You know, these are the questions they're going to be asking you. They're going to ask you if it hurts anywhere. And so if it is hurting somewhere, you know, maybe you can practice showing on themselves or showing on mom, so that they're prepared for that. You know, the doctor might want to know if they're having pain, if anything makes it better or worse. And so preparing your child to help communicate that. That's definitely, you know, something that question answer child could do. And then, you know, also preparing that, so you could prepare the child for questions they might want to ask, and then questions the doctor might ask. You know, one of the things that we talked about in our work group was that it would be nice if you had a way to get the questions ahead of time that the nurse is going to ask you when you first come into that exam room. And this is, you know, specifically related to doctor appointments, but you know, I know for when I took my kids to the doctor or go to the doctor myself, based on your age, they have a certain list of questions they're going to ask every single patient. And so we talked about, you know, how great it would be if a parent could maybe ask for that list of questions before they go to the doctor. Is there any way that you could do that so that the child already knows what they're going to be asked, and then they have the option of trying to answer themselves if they have that ability, or they can have their answers already set up in their iPad or their device. So that was kind of an interesting rabbit hole to go down, because I think that if you started asking those questions of providers, it might be something that you could have them provide your family. So other things that we included based on the feedback we got was there was a suggestion to include a blank calendar, medical history or information sheet. So that one is kind of a little section that says about me. And, you know, one of the parents that had a young adult that was kind of that transition age was saying how helpful it would be for their young adult to have that they could take with them, even while they're at work or at school, so that, you know, if anything were to happen, they have that information readily available. And, you know, if they're anxious and stressed, it might be harder to answer those questions in the case of an emergency. And so if you have that available in some way, that would be helpful. And then at the back of the book, it has the pain scale as well as some visuals for body parts. So just kind of a visual that families could use to practice with the child, as far as being able to identify on themselves or another person, maybe where they're having pain or if they have questions, or even something that if the parents took this resource with them, maybe the healthcare provider could point something out on this familiar visual. And I've talked a lot about using this in a doctor office, but really, I think this is something that you can use. The ideas and strategies can be used for therapy appointments, to go to the dentist, to go to the chiropractor, basically any medical provider that works with your family, you know. And the flip side of that would be to start trying to share these with medical providers themselves, and to train them on this idea of how they can support families and children to be able to participate more, so that when the child's in the doctor's office, they turn to the child first to ask a question rather than the parent. And you know, I know as a parent of of 3 fairly typically developing kids, you know, even going to the doctor. Sometimes they were shy to answer questions. And so, you know, it's always nice when the doctor turns to them first to ask those questions, but there's times when the doctor will refer to the parent first. And so having that conversation, if that's a goal of you for your child and your family, to really be proactive and say, hey, you know, I have this resource that we're using, and maybe it's something that you could take a look at, and maybe we could work on this together, to really establish those goals and to have the support that you need to work towards those. So yeah, so I was just talking about the providers. So, you know, when we think about the amount of time that most providers have with us these days in the healthcare setting, it's not a lot. And so always recognizing that that's a challenge. But I think that especially in the world of pediatricians or therapists, having those conversations to say that this is something that is important to you and important to your child, and really address it in a way that you can try and get that provider's buy-in, I think will really benefit your child, because as they begin to mature, then they can, you know, begin to be more confident about maybe speaking up or asking a question. And then when they're ready, you know, you've been building those skills over hopefully many years, so that by the time they're, you know, in that youth transition phase, they're ready to start making their own medical appointments or manage taking their medications, getting those prescriptions refilled, or call to arrange a ride to get to their therapy appointment. All of those things that we would love our kids to be able to do before they're either out of the house or just working towards a more independent living situation. So when we finished this project, we kind of had a distribution plan, and we were really fortunate that our faculty mentor, Molly Kimmel in Montana, really kind of took the bull by the horns on this. She was really excited about the project, and so she took it to somebody within there. You said, I don't know if the person is on staff as a graphic designer, but certainly that was the ability that this person brought to the table. And so she was able to have them take it and do some graphics work to it, as well as make sure that those resource pages were fillable if you downloaded the PDF. And then the other thing that they did was they were able to store it in their ScholarWorks site at the University of Montana. So it can be downloaded directly from their site, and then they have the ability to track the number of downloads if we were to go back and look at that. I think our group would love to see maybe some research done at some point, whether it's a parent survey or some way to kind of find out if it is a beneficial tool, if it's something that families can and want to use. So I would certainly love to be a part of that at some point. And then finding ways to present to providers. I think that would be a really important goal for us to have on a regional as well as maybe a national level, to present to providers and really talk about their role in supporting decision making and preparing kids for that transition age to be a little more ready for that transition out of pediatric care and into the world of adult health care. And I think most doctors would recognize that they do have a role in that, as well as therapists and dentists and all the providers that our families use to meet the healthcare needs of our children and ourselves. So that would definitely be one of the goals that we have. And then, you know, we're really blessed that they do have the ability to maintain our product at the Montana State University. And by having it in that digital format, stored at their site, they have the ability to update resources in the product as needed, make any adaptations to that as we go. And then finally, we talked about future development. So, you know, as part of our work group, we did do a little bit of dreaming. And we talked about how great it would be to have something like this in an app format. We had a young adult who's a university student, and she was saying how great it would be to be able to go into the doctor appointments and have that available on her app. And it was kind of echoed by a teenager that we were able to get in our second work group, who was a high school student with who, like, not that long ago had been diagnosed with type 1 diabetes. And so all of that was a pretty big life change for her, and learning to manage all these medical things, go to appointments. And so she was also saying, you know, it would be really great to have that in an app format. So that would be a dream, to be able to take it to that level at some point. But we're pretty excited to be able to have it in digital format right now. So it looks like,
Rebecca, the link that you had put on there, I can't get that open. So if you don't mind, would you email that to me, and then I'll get it to everybody that was registered for tonight too?
yeah, for sure. Yeah. Follow
Okay.
up.
I don't know why I can't open it in here, but it won't let me.
Yeah, okay. And let me see if I can, because I know you can go to their website as well. But it's the easiest thing to do would be to go ahead and get you the correct link. I'm not sure what happened there. Looks like we have a couple chats on here. I'm just going to see if I can open those.
One was just from me asking for the link.
Okay.
But I just wanted to say, like, I think that several of those forms we could use at different stages with long-term follow-up for newborn screening, especially, you know, like helping parents to formulate their questions before they go to the doctor, but then also as the kid gets older and they transition out into the school age, using those to be able to have that kid starting training right away, like how do they communicate with their providers, because it's going to be a lifelong thing for all of the conditions that we follow up on. So yeah, I really liked those.
Yeah, and you know, when you mentioned the school thing, I think at some point you could kind of take this idea too and adapt it for, you know, sort of that IEP experience to support families to feel a little more empowered during those IEP meetings, and then maybe to work on opportunities to give the child a little more independence and decision-making power as they get older with that IEP process. So that's
Yeah, absolutely. I'll talk to Heather about that, because she's our school nurse consultant. And so she works with the school nurses, and they're a lot of times in on those IEPs and different things. And so they could bring it to the schools. So I think that would be good.
Yeah, I think so too.
Brielle has a question for you, Rebecca. Are there any good visual, what did it say, Brielle? Any good visual checklists for children on the spectrum?
Yeah, so so one of the resources that we put in there was Teachers Pay Teachers. So that's a great site to go to, because they have visual supports of all kinds on any topic you can imagine, it seems like. So that would be like a ready-made thing that you could go to, where they would have visual supports, they would have social stories already created for like doctor visits. There's another resource on here. It's called Due to Learn, Social Scripts and Pictures. So that one has a lot of resources available for different ages and stages. Let's let's see.
And those are listed on that website link too?
Yeah,
Okay.
Yeah. yeah, boom cards, that would be another one. I don't know if you guys have heard of that one.
Yeah,
Mhm.
we have been doing boom cards.
Okay. Yeah, so
What
some of
was the last one you mentioned? I'm sorry.
boom cards was the last one, but before that, do to learn. So like the word do, the number 2, and then the word learn. And that's some social scripts. So do2learn.com is the website. And they have scripts and pictures on there.
Thank you.
Mm-hmm. And then I had mentioned Book Creator. Pictello is another one. Pictello is like a $19 app, whereas Book Creator does have a free version. And then, another great website for some resources is the Texas Children's. They have like the Texas Children's Autism Center, and they have a whole thing in there on preparing for appointments for kids on the autism spectrum. So that's another nice resource. So once you get the link and you kind of look this up, then you'll be able to see, and you never know, like once you're on the internet and finding some of these things, it might lead you to other things as well. There's one called Model Me Kids. So that's videos for modeling social skills. So that might have some on the topic of doctor visits. So yeah, there's just a variety of things in there for the different stages. And, there is a note in there that the information is accurate as of June of 2021. So I don't know how often their ScholarWorks people will go in there or even the USAID there in Montana, go in and kind of look to update resources, but certainly a good starting point.
For sure. There's a lot of materials in here because we have a care coordination training that we do, Rebecca. And then we're also working on a transition curriculum for families and for the youth. So I think there's a lot of tools in here that we could also present to both the families and youth as well. But I do like the starting to teach the kids at a much younger age on some of their healthcare decision making as well. I know for our oldest, or our middle son that has a significant hearing impairment, that's something that we started with him early on, and I'm so glad that we did, so that he started. I just kind of still chuckle about one. So he started speaking up for himself, but I remember on one occasion he had whooping cough, and we ended up taking him to the emergency room, and I don't know what I want to say about the ER physician that was there, but he checked everything in his nose, and then he goes, yeah, your ears are clear. And he spoke up and he said, well, how did that happen when I have my hearing aids in? So you know what I mean? So he hadn't even checked his ears. So it's just kind of funny how, different things he learned how to speak up for himself. So that was pretty cool.
Yeah, that is cool. Yeah, and I think, when we think about our kids and the way we're, especially if you're working on communication skills, you're constantly looking at ways to support them making decisions in the home setting and making choices. And I think what happens is we don't always translate that to other settings that, maybe we're not as comfortable as parents either.
Mm-hmm.
Letting them have the main voice in the room. And that was something that kind of came out of the research too, is that, not only are healthcare providers not proactive, but sometimes as parents, we can be hesitant as well. And so I think just being conscious and aware of translating all those skills that we're working on at home into this other setting recognizing that if we start young, you know, as they get older, they're more prepared to use their voice and advocate for themselves and ask questions. And so,
Yeah. Joan or Brielle or Amy, do you have any questions for Rebecca at all? And again, this was recorded, so we'll send out the recording to on a message like you got on the registration of the recording, and then also the link for the resources as well.
I don't have any questions, but I found it super helpful, and I'm super glad that I attended tonight. So thank you very much.
oh, you're welcome. I'm glad it was helpful.
And this is Joan. I too want to say it was a great presentation, and I agree, something that's very needed. And with my daughter, well, she's 28 now, but I at a young age had her talk at her appointments, order her medications. I thought if something happened to me, she needed to know how to take care of herself.
For sure.
And now it's paid off at age 28. She's very much a self-advocate for another route of a medical, I don't know what I want to say. Deneen knows. Anyway, so she's a great self-advocate as a young adult now.
Good for you. That's awesome.
This is
Well,
Jan. Sorry. I found it very useful as well, and I can't wait to incorporate it into our visits with psychology with my son, just because, and I accidentally, when I registered it, it had entered my daughter's name, but this is Jana Kate Walker. So anyway, my son, you know, his psychologist always asks him about how his medication makes him feel. And, you know, I would just love for him to give us that feedback so we know that we are, you know, providing him the proper treatment. And so this has been super, super helpful.
Good. That's good. Yeah, and I don't know if anybody would, I could put my email too in the chat if anybody ever wanted to.
Sure, do that, and then I'll send that out as well with that link, Rebecca, to the rest of the group. I know that there, like I said, there was many more than this registered, so with COVID, God only knows what's going on.
Yeah, we've had a lot in our area as well. Staff that are out either with it or a family member that's with it. And yeah, I'm hoping it peaks and then dies down here pretty shortly.
Yeah, for sure. I did hear today that it would probably be about mid-February before we would hit our peak.
Oh, okay. So that's
and that was from one of the healthcare providers that we work with. So I don't know, we'll see. They didn't think that we would get this peak either, so who knows?
Yeah, I don't know that they know for sure what it's going to do anymore. So I was just checking online to see if, because at one point I thought we had a QR code on it as well, but it looks like our latest version does not have that. So I'll just I'll get that link and get it to you, Deneen.
Okay, that's great.
Okay,
great.
any last questions before we go?
Well, thanks everybody for coming on. And like I said, I will get this out as soon as we can. We're playing a little bit of catch up with some of the things going on because of the server. So it's been really kind of an act of Congress, but we're getting there one day at a time.
Right.
So thanks, Rebecca. And I'm anxious to hear how things turn out with your doctorate too on the other project that you're working on.
Well, I actually finished, so I've been done with that for a little bit now. So yeah, that one was really interesting. I didn't get the turnout that I was hoping to for my survey. It was on participation, parents' impressions of their teenagers' participation in both community-based and school-based activities. And the feedback that we did get out of it definitely shows that that's a huge area to focus on as well. Definitely a need as far as creating opportunities and providing supports to get more teenagers with disabilities or special healthcare needs involved in activities with peers. So
Yep.
yeah, something to keep looking for ways to work on that as well.
For sure.
Yeah, but I was definitely appreciative of your support in that project.
Yeah. Okay, everyone, thanks for joining, and I hope you have a good rest of your evening.
All right, bye-bye.
Bye.